Efficient use of healthcare resources is one of the most important tasks for our society. With automation, we can optimize certain pathways, free up time, and increase healthcare's capacity to deliver high-quality care equal to all. But how do we automate in a way that alleviates healthcare today and meets the needs of tomorrow? Healthcare is currently using decision-making trees to support collection of medical history and triaging the patient to the right level of care. Decision-making trees work fine when used by a healthcare professional who can easily switch track, or even decision-making tree, when new information that may affect the outcome is added. In automation, it may seem comfortable to reuse a model that is already known. But a digital decision-making tree has its limitations. The challenge of a digital manifestation of the tree structure is the assumption that the patient provides the most important information first. Once the system has entered a track, it is difficult to switch to another, even when new information is added that shifts the previous information to a different area. That's where Red Robin comes in. Red Robin is an automated triage and medical history tool. Instead of a tree structure where information is attached to a specific sequence, Red Robin uses a network structure. The network structure can make the best use out of all the information collected, and as the system receives new information, it performs continuous reanalysis. The network simply affords to take a new path based on new information and data sources. Just like a human, Red Robin collects and compiles relevant information from the patient, refers the patient to the right level of the healthcare chain, and consequently facilitates administration and supports healthcare professionals in medical assessments. But how does it look in practice? This is Emma. She is 31 years old and she's been having issues with a cough as well as difficulty breathing for a few days. She contacts her GP digitally and is met by Red Robin. She describes her symptoms in her own words and then enters an automated dialogue. Red Robin asks questions and adjusts the follow-up questions accordingly, based on Emma's symptoms and responses. Red Robin continuously analyses new incoming information and concludes that pulmonary embolism is a diagnosis that needs to be ruled out. Due to the severity of the symptoms, Red Robin recommends that Emma books a time at her GP practice and redirects her to book a physical appointment at her GP practice. Prior to the appointment, the clinician receives a summary of Emma's case and suggestions for possible diagnoses. This facilitates a more focused and efficient consultation. The clinician can easily transfer the information from Red Robin's summary to the EPR, putting patients first and guiding them to the right level from the start. Healthcare resources can be used more efficiently. But Red Robin's greatest strength is that the system is future-proof. With the help of continuous data input in the form of measurable data as vital signs, risk factors and external data, the symptoms input from the patient, and continuous validation of the medical core, the tool will eventually be able to make increasingly independent decisions, such as refer patients to self-care or further testing. By collecting and processing information from the patient, Red Robin can assess severity and refer the patient to the right level of care and consultation channel. The patient receives more individually tailored care and lands at the right level of care from the start. Healthcare professionals receive decision support that facilitates administration and makes the consultation with the patient more focused. This way, healthcare is provided with a tool and the conditions to increase capacity without compromising quality or patient safety. With Red Robin, you not only strengthen healthcare today, you are also prepared for the healthcare needs of the future.